We all know that during cardiac arrest, the first thing to do is to call the emergency hotline. But before professionals arrive, what can they do? What can you do? Most of us are aware of what CPR is, but are you ready to perform a CPR during an emergency situation? Before I demonstrate the CPR procedure, let's watch this video first.
Thank you.
So there you have it. What would you do if you're in Mr. Bean's position? The American Heart Association, or AHA, reports that the first official support for a mouth-to-mouth resuscitation occurred in France in 1740, when the Paris Academy of Sciences used mouth-to-mouth to revive drowning victims. Chest compression was first documented in 1891. Modern CPR came about in 1960. In 2008, the AHA released additional guidelines wherein an adult whose heart has stopped can be saved. Cardiopulmonary resuscitation, also known as CPR, is an emergency procedure consisting of chest compressions and artificial respiration. It is designed to pump the heart that has no pulse to restore the circulation of blood. It can also prevent death or brain damage due to lack of oxygen to those who stop breathing. If you find someone collapsed, just remember Dr. A.B. D for danger, R for response, A for airway, and B for breathing. Ensure that there are no dangers to yourself, other bystanders, or casualty. Ask yourself, why has the casualty collapsed? Are there any hazards? Am I at risk? Dangers could include moving vehicles, fire, electricity, or water. Try and wake the casualty up. Is he responsive? Kneel by his head and ask him what happened. If the casualty didn't respond, tap him on the shoulders. If no response, the casualty is unconscious. If the casualty does not wake up, it is an emergency situation. The airway is the tube which takes air from mouth or nose to lungs. Unconsciousness means that the tongue can fall backwards and block their airway. This can cause obstruction and stop the casualty from breathing. To open someone's airway, place one hand on their forehead and tilt the head backwards. Place two fingers on the bony part of their chin and lift it. This is known as the head tilt chin lift maneuver. Keep your hands on the person's head or chin. Place your cheek above their mouth and look at their chest. First, you should give 30 chest compressions. Place your hands in the center of the person's chest over the breastbone. Interlock your fingers, then push down 30 times at the rate of 100 to 120 compressions per minute. Push down to depth of about 5 cm. After 30 chest compressions, give 2 rescue breaths. Tilt the casualty's head backwards, lift their chin, and then pinch their nose. Continue the cycle of 30 chest compressions to 2 rescue breaths until help arrives. Cardiopulmonary resuscitation is an important skill that each one of us should learn. You never know when you may need the skill to save someone you love or to be a hero to a stranger. Knowing CPR empowers you to help someone in need. Situations may arise when you come across someone whose heart or breathing stopped. Conducting a CPR during emergency situations can save a life. Doing something is a lot better than doing nothing. So the next time you're in an emergency situation, keep calm and remember Dr. A.B. Danger, response, airway, breathing. Thank you. Have a good day.